And the eyes. 3, 2, 1. The eyes have it this week on Dr. Joel Saylor from Dowland Country Veterinary Clinic, just up the road a piece from Eagle Country, and Pet Tips every Monday, Wednesday, and Friday. So the eyes have it this week.
Yeah, I just want to talk a little bit about corneal ulcers, and so one of the big concerns with corneal ulcers, if they are left untreated, you could lose an eye, and so you want to be really kind of a little more immediate when you're trying to treat eye issues, because a lot of times we'll see them and say, well, yeah, the eye's been bothering for a couple weeks, and when we see them, it just looks, nasty, and then we're looking at possibly removing an eye, and we don't like to do that. And it's just, you'd rather them keep your eyes if you can. You have to be careful, because a lot of these ulcers can melt down in a very short period of time. Now, the breeds that we are most concerned about with this are going to be what we call brachiocephalic breeds. Okay, and a brachiocephalic dog is one that looks like he was running really fast and ran into the wall and smashed his face in. Okay, so that's going to be like your boxers, your Bostons, your pugs, your Pekingese. So they got the really short muzzles and the eyes that kind of poke out. These dogs all are more susceptible to corneal ulcer melting, and melting is a really big problem, because when that happens, that the organisms create these enzymes that just really liquefy that cornea, and they can basically go from normal to almost destroyed within just a matter of 24, 48 hours. So you really have to jump on those. So the caution today is, is if you do see a mild eye issue, try and be more, immediate about getting them in, because if you don't, you can really cause a lot of problems for that eye. So don't wait on that eye. If your pet's winking today, don't wait. Get them on in.
Can you, in a sense, if there is some vision loss, can vision be restored, or at least can stop it in its tracks from getting worse?
Yes, as a matter of fact, if you get the ulcer taken care of, the fear with the ulcer is that the ulcer goes all the way through, and it actually then becomes a perforation. Once it perforates, that globe decompresses, okay? And when it does, a lot of times the retina will peel off the back of that eye. Once that happens, vision's gone. But a lot of the corneal scarring and ulcers, as long as you get it healed, will reverse, and they'll regain all their sight.
Very good. We'll be back right after this.